So now we come to quality of population. So there are three main factors that affect the quality of population. The first one is literacy rate, then the health and the skills. These are the three ones that determine the quality of population. So now we have a choice. The first one is the illiterate and unhealthy population that are the liability for the economy and the society. Liability is a burden. Liability means a burden to the society. Whereas the literate and healthy population can be made into an asset for the economy. Asset is something that is productive for the society. Now, the literate and healthy population, as their assets, also contribute to the GDP of the country. So, first one, education. The primary pillar of human resource development is education, because education defines the literacy level and also the skill level of a person, and in turn also helps in enriching the culture of the society. Now, educated people, that is education, also has a spillover effect. Spillover effect is that the educated population also create comfort or provide other facilities also to the illiterate people of the society. That is why our government is striving to provide universal access of education. It is also making various plans to increase the retention of students. What is retention of students? Retention means to keep the students in the school. And for example, there was a scheme that is still going on, that is the midday meal scheme. The midday meal scheme, the main aim was to enhance the nutrition and also to keep the students, to increase the retention, because the people who are poor, they were sending their children to school as they were getting a meal, a complete meal. So to increase retention, and special emphasis is also being made on girl education. The next one, so here we can see learn, educate, change, because learning and education brings the change in the society. The next one is health. So a healthy person is the one who completely realizes his potential and can be an asset for the economy, as you can see in the picture. Whereas an unhealthy person does not realize his potential, is not capable of working efficiently, and that is why is a liability for the economy. The National Health Policy of India is aiming to provide access to healthcare services and improving the nutrition, especially among the underprivileged and the backward classes of the society of the country. So now we will study some of the government health systems, how the government health system works. So to reach everyone in this diverse country, the health system is divided into a tier system, into a level system. The first one is the primary health centers. The primary health centers are the bottom of this tier and provide general medical care to the rural people. इसमें सिर्फ बेसिक फैसिलिटीज़ प्रोवाइड होती है, स्पेशलिटी फैसिलिटीज़ नहीं होती मोस्टली. Then the second level is the community health centers, that is CHCs. These are the bigger ones and these are at the tehsil or the block level towns. Then we come to the district hospitals. These are at the district levels. Then the last level is the medical colleges that are present in the major cities or metropolitan cities, you can say, where the doctors are available and for all the specialities are present. So this is the government health system.